Welcome to the Beauty Beyond Bella podcast. I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Welcome. This is Dr. Hermann. I'm so excited to have you here. As you know, I am a big fan. Quick little tidbit that I don't think everyone knows that Dr. Hermann and I went to the same medical school.
Yeah. I'm so excited to be here. We have met many, many times as well at trainings because we are trainers. So the trainings for trainers. But this is my first time in your spa and it's gorgeous. Teary eyes, Chase. I love it. See? But yeah, so it's funny that all these years we've been knowing each other and didn't even realize we went to the same medical school. I love it.
I know. To see another New Jersey girl, I'm so proud of us.
Me too. How we live in this beautiful journey on the road, best in the world.
I am impressed though. You know, when I went to what's now called Rutgers Medical School, which is kind of crazy. I went to Rutgers undergrad and then Rutgers Medical School.
Yeah.
We didn't have any aesthetics and any wellness. And so I went to school and did pediatrics and then ended up doing emergency medicine. You did internal medicine. How did you even get?
I know. I actually say to people, if I had known aesthetics existed when I was in training, I probably would have gone into that. But at the time, even dermatology, what they taught was skin cancer, skin diseases, things like psoriasis and rashes. There was really no aesthetic training. So it was something, and part of that I don't think is the medical school's fault. I think some of that is that the field of aesthetics really started taking off in the early 2000s. And you and I both graduated medical school in 2000. So
Your agents.
well, no, I think how much experience we had. Yeah, that's true. Both of us have been doing aesthetics for almost 20 years, right? For me, I know I started my practice 20 years ago.
Medicine?
Years. Yeah, exactly. So we've grown with the field as far as, like I think you and I, like you can speak to this too, probably remember each product as it's rolled out, pretty much, starting with, should I even use proper names? I don't know that.
Okay, I do remember starting with collagen. Do you remember starting with collagen?
So I did not start.
I started hyaluronic acid fillers. So maybe it was a year before you. So literally collagen only lasted 3 months. And so people would come in and that was all we had. And they were excited for that. And now look, you ask them, you give them a filler that lasts up to 2 years. And they go, that's it?
Right, sprays.
Like just a week.
Yes. And just all the different varieties because originally we just had maybe one hyaluronic acid filler and we had to use it everywhere or understand that we could not use it in certain areas because it wasn't good in certain areas. But now we have, ones that are more robust and firm for lifting and really thin ones for, refining fine lines or tear troughs, and makes such a difference.
It really does. And I don't think the audience normally knows, when people come in, they'll go, I just need a filler. Yeah, for example, obviously us being outed in trainers, we're a big Juvederm fan. And so what I try to explain to people, even starting in this business, is, we had probably 15 fillers at this whole thing, 15 types of fillers. And same thing to you, I tell them to get a soft, flat filler.
Yeah.
And then a medium filler, and then a very deep filler with that high G prime. And I think patients don't understand that you really need to leave it up to the provider to know what's best in their hands.
That's right. A lot of times patients will even ask, oh, can I use this one with that one? And in my opinion, I agree with you. Usually you want both. I sometimes think you've got one that's more for structure, and then you've got almost the icing on the cake, which is you really do inject it much more superficially, more for, final texture, and
But don't you love when they come in and go, I have to have this filler in my lip and it's the only one I want?
Yeah, right. Sometimes they're right. And sometimes they know they've already been through multiple iterations. And sometimes we have to be the ones to tell them, okay, actually looking at you think today anyway, it's more about maybe just symmetry or whatever and just need a little of something.
Yeah. Well, I love that you bring up the word symmetry, right? We are now in the era that we talk about facial rebalance. No more are we trying to overfill to compensate for age. We really are helping rebalance, but both devices and products that are going to build collagen. I think that's still kind of hard. I think people come in and want to get overfilled, but now we're turning it around. And you have these younger girls. So how are you dealing with that at your practice?
I mean, I think that's exactly right. And I actually believe that the knowledge that overfill is a thing helps me, because I can say to people, okay, we don't want, to get that look. And they know what I'm talking about, shall they? And they'll usually nod and agree. And I'll say, okay, so I think what you're really seeing is XYZ. So for instance, if we're interested in contouring your jowl and they think they want more in their cheeks and to lift, now we're so sophisticated, we can do jawline filler, which will help the jowl. There's, other modalities, like you say, skin tightening and things like that, threads, pedio threads, so many things that we can help them without overfilling that they're unaware of. And so I think usually it's just education. Make sure they know what's available.
Do you remember when they come in normally, right? So people only see what they can see in a mirror. So they see, right? They see their cheeks, they see their nasal lymph folds, and they see their lips. So they always want to fill here. I think social media has shown us that we always look now laterally, right? And so now we've learned that if we fill the temples, the eyebrows, the lateral cheek, that jawline, going peripheral now, where they don't want to normally do that, they're just going to make them much more natural.
I agree with that. I mean, a lot of what we see in aging is hollowing, around the edges, and people aren't going to look at you and think that you're overdone. You're not even going to really recognize that it was done, which is why patients don't come in and ask for it. But then once they have it done, they realize they look so much younger, that a lot of the volume loss that happens in the center of the face is really just things falling forward from lack of volume laterally. And we're in the era where these things are so sophisticated. Yeah.
I think when I tell my patients, if you leak here and no one knows you had a filler done, but they just think you had it being haircut or look great, then we did a good job.
Yeah, exactly.
And that's sometimes hard for them to say that, right? Because they want to see this big change. But those small, I tell us, we want to look 10 to 15 years younger than we are. Right? We're not going to be 20 anymore. We're not trying to look there, but to look the best that we can. I think that's where we're trying to get to.
I agree with that. If you get the impression of health, and, that is beauty to me. You get the impression of someone who's, glowy and not gaunt and not, and that gauntness, that is the thing, because you could be physically fit. But then sometimes, have you noticed, sometimes people who have a little extra weight on them, it actually looks good around face. Just, when they lose the weight, that's now. But so a lot of really looking good is projecting into health. It's not necessarily every little fine line. He's very healthy and have.
Well, the body's kind of opposite, right? So we talk about now people being on the GLP-1s and they're losing a lot of weight, trying to talk to the patient and making sure that we are kind of enhancing their face as they're going through the journey. Because what we don't want, right, as this looks better,
right,
this does not look better. Yeah. We need to kind of help them balance between their weights and their injectables.
Yes. Yeah, that's absolutely right. I usually tell people when you're getting within about 20 pounds of your goal weight, that's when it's time. Sometimes people ask when is a good time.
Right.
You think, I don't have to matter, Ross. Right. 20 pounds is close enough.
Yeah, I agree. As they go through that journey, little bits. Look, as soon as you start to feel like they're starting to get a little deflated, having that little bit of help,
that's right.
It's not a bad thing. So you talk, wanted a little bit of wellness. It was hard for us to get into that, I think, 20 years ago.
Oh my gosh, was it ever.
So I went back and did my fellowship and fell in love with it. And I think the hardest thing for me, and I used to tell patients, it's actually much easier for me to make you look beautiful than to feel beautiful, because you have to help me with that journey.
That is an excellent point. I mean, we can work on hormones and, which are basically prescription, but as far as nutrition and exercise and lifestyle, as far as getting good sleep, the healthy habits and all those things, that is definitely something. But I feel lucky, I feel fortunate, I bet you do too, that are usually the patients that come here and want to feel good are the motivated patients. We get to work with people who usually come to us already willing to put some effort in.
I agree. I think, though, on the wellness side, bioidentical hormones is probably really only come to the forefront in the last 5 to 10 years and still have a lot of good stories behind that. And so I always tell people I can sprinkle a little testosterone on everyone. We would just have a happier.
I nourish that. And even women, that the normal level of testosterone, men's, testosterone levels should be much higher than women, that we also have normal levels. And if we are low or below the normal levels, we absolutely suffer as far as our own energy and libido. And it is sort of overlooked in sort of standard, maybe thinking F1 replacement therapy for women makes such a difference.
So you came from the internal medicine field. I think I was talking about my biggest pet peeve is that when women turn 50 and we go to the doctor and we say, we're tired, we can't sleep, we lost our libido, we can't focus at work, and the first thing we're getting is an antidepressant and a sleeping pill.
Oh my gosh.
Okay, that really bothers me.
Yeah.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
Okay, so I'm even going to go further back. I remember, because I did research on thyroid performance during my residency. And I remember talking to some other physicians who were just so not knowledgeable about women and hormones. And when women would say their libido would be down, they would say, well, maybe you should get some lingerie. They had no understanding stories like, did you have this to this? Right, that there was actually a physiologic thing going on. So, but I'm sorry, so then you were saying,
yeah, look, when we're 50, right, we gain weight around our abdomen. Women have a hard time losing weight. So we give them a pill if we don't treat their hormones.
Right, exactly. So I think there's a big fear of, first of all, the safety of hormones. So a lot of physicians don't want to get into it. But, if you really know what you're doing with the hormones, you can tease all that apart, give very realistic information about safety, which typically for women who have been on bioidentical hormones or any type of hormone, frankly, for less than 5 years, statistically speaking, there is no increased risk compared to people not on hormones. And then women who start hormones at an earlier age and kind of stay on them, frankly, their life expectancy is the same as people who never, are not on hormones. So there's a lot to be had in that conversation. It needs to be done. It needs to be done right, of course, with routine screenings and making sure up to date on your, mammograms and pap smears if you need those. And but I do believe there's just so much fear mongering for women, strange enough for men, because the men, look up putting a man on testosterone and he's low.
Correct.
Yeah.
And it's a struggle for all of us, I think. Even we have plenty of colleagues here in Tampa that don't believe in bioidentical hormones. And so I get a call from them saying, why did you put my patient on bioidentical hormones? And like you said, I can show them the studies, right? I think we had a study back in the day that scared people, but when you really look at it, they were progestin, which is not progesterone,
right?
And they were not estradiol. They were not bioidentical hormones, right?
Right.
Using horse urine, and
they were older women.
But
even that study, they did not find any negative benefits until after 5 years. So a lot of times I'll tell people, boom. And that study has now been teased apart, and certain subgroups and things like that, ongoing without progesterone, for instance.
But as we've had hormones our entire life, when do we feel the best? Our 20s and 30s. When do we have the most hormones? Our 20s and 30s. So as we age, if we have our thyroid is not functioning, we have no trouble giving them a thyroid prescription. That's right. But as soon as our testosterone is not functioning, you'll be fine. You're just going through menopause. Just
live with it. Yes, I can other test. What is?
Yeah, I want to sleep. Don't you want to sleep?
Yeah. Yeah, no. But I think this is also women empowering themselves. Just going through menopause is something that does not need to turn us, I don't know how you feel, but now I'm hitting that, 51. So, getting to that age where no, I don't want, of so many of my patients, I've been treating patients for hormones since honestly my research. So, back into the early 2000s, so more than 20 years. And now that I'm experiencing some of these issues, no way do we want to all obsess it. You know what I'm saying? I mean, and women will tell you, they go from feeling like a young person to not young in a matter of 1 or 2 years, or months even. And they're fine, kind, and then all of a sudden, not thinking, well, even in a month, and it's the weirdest, not weirdest thing, but to experience it and to know that there's treatment for it and something that you be safe and done well. And by the way, now, even the regular medical community is recognizing that it's kind of like they kind of went a little overkill with the fear mongering. And I do believe, and I'm sure you've seen this too, that even breast surgeons and people who are in the field of sort of OBGYN and stuff realize that women probably do benefit from hormones. But they're still sometimes afraid to do it and do it right, in my opinion.
I don't know. I still think there's a lot of fear mongering. I don't know if you're aware that I went through breast cancer 3 years ago, and I had a fight with my surgeons and my oncologists to even believe in treatment of testosterone again and to try to help someone. And out there, look, the number one reason that women die is heart disease, right? And so we know that hormones help us with heart disease. So why are we not treating that for potentially 3 to 6% decreased risk, which had no studies that it would occur anymore? Yeah. So we fight this out. I don't think it's going to go away. And I'm not trying to say we treat everyone, but I think that we need to empower physicians to really be able to talk to patients openly about it and not scare them into something that could potentially give them that much better longevity and quality of life.
I agree with that. And my little extra tack to that is also the bone health.
Yeah.
This fractures are also up there with high cause of mortality for women. And being on hormones helped with the bone health. It was very brave of you to have fun on it. So did you get your...
I did. I hope 3 years right now clear. I've gotten just went to see my new surgeon, and I'm guilt every year now, and I've gotten to go back on my testosterone and just that little bit of that focus of that energy. It's so surprising. I call it for men. It's really pretty obvious, right? I feel like they get the couch potato syndrome. They come home, they've worked all day, they sit down, you can't get back up to do anything in the house.
Right.
Well, women, we don't really get a chance to slow down. The kids are home, we're cooking, we're doing this, we're doing that. And as soon as you give a man testosterone, their whole world changes, right?
Yeah.
We're the same way. Overdone required this much trying out to them.
Yes. It does really make me wonder. I mean, I had women, patients go on a little testosterone, like we said, in physiologic doses, what's normal for a woman, and their world rocks their world. And they're at ACP like, what are we all missing?
And they only save some marriages too.
Oh, yeah. How many couples have you seen?
I will right home at the right coming. You guide your life, you get some feeling better. The husbands come in, they're just, I don't know, they're re-energized, and I love that for the husband. I absolutely love that. I will tell you, I remember when my family members went to my flashes, and same thing, I was just like, oh, how bad can it be? So you're a little hot. Okay, when I went through mine and they took all my hormones away with Vaziagils, yeah, terrible. Yeah, drenched, bed soaking wet, covers on, covers off. I had a chilling pad on my bed. I mean, that's terrible.
I mean, with you work, have to get up and go, and take care of things. It's not like you just can then get a bad night's sleep and then somehow just relax the next day. You gotta function.
I agree. And once you get on the mortals, they fix it. But I will tell you, that chili pad was amazing. Between the fan, freezing me on top, freezing me on the bottom, cooling guys. I even have patients that sand me down when I was injecting them because I could kind of estrogen, and I would start having a hot flash, and I could see them using the chiller on me to kind of help me out. It was so kind.
That is very how so kind. I thought that.
So I have to ask you the main question.
Yes.
What does beauty mean to you?
Beauty to me, why do we try to achieve beauty, really? I think it's because we're trying to achieve happiness. So, yeah. So to me, I think beauty really is an indication of health. When we look at someone and they seem healthy, no matter what age they are, but good hair, bone skin, posture, energy. I think these are the things that when we get fixated on beauty, I think it's really more about wanting to feel good and project that to other people. which makes us happy.
I agree.
Yeah.
And if you had to give some advice on women taking control of their lives, whether it's aesthetics, whether it's wellness, before it was kind of frowned upon that we wanted to look and feel good. I think that's turned around. I think people are very vocal about what they do now.
That is right.
What would you say?
Right. I mean, I honestly would even say I said this to patients. As every once in a while, I'll, be like, ugh, I did internal medicine. I worked in hospitals and, heart attacks and strokes and, diabetes and treated all these things. And sometimes it feels like, oh, now I am doing this. And patients will tell me, my patients are sometimes my best, like friends, I guess advocates, great, that's the right word. Where they're telling me, no, you made me feel better. You helped me function. This is as important to me as any other aspect of my life, as any other aspect of my health. So I would say that to patients too. People who are embarrassed that they take beauty treatments or something like that. It's like, you know what? Well, you don't have to tell people, but really be proud that you're doing what you can to make yourself feel better and look better. And I mean, you're basically trying to live your best life. Yeah.
And I was going to say the same thing. The fact that we're honored to be able to make people feel and look their very best is a specialty that I'm so glad we kind of just fell into.
I agree. Yes, an honor that people trust us with that. And yeah, exactly.
Well, it was amazing having you here. I know you're busy and we have to go, but thank you so very much.
It was so amazing to be here and so great to see you. Yes. Take care.